Mental Health Monday.
Another episode of Mental Health Monday. Another episode of Mental Health Monday. You saw they came out with the whole opioid thing on Netflix this past weekend?
I've been hearing some stuff about that.
Yeah, it's out there.
I heard it's good.
Yeah, I'm not watching it yet.
I heard it. That's the painkiller one?
Yeah.
I heard it's good.
Yeah, it's there. It's out.
Yeah.
It's out. It's out about. That's gonna be a hard watch, man. That's gonna be a hard watch.
Yes,
because like there's so many ways that plays out in different people's lives, and it's like you're not. A lot of people are very private about a lot of their family stuff and what they've gone through, and you don't. When it comes to these episodes, you just don't know whose family are really affected directly by these decisions.
Exactly.
Yeah, and you don't ever find out until like years later. So.
That area of population is a tough population to definitely engage and work with, and that's why it's super, I think, important that they have mental health support because of that. Family traumas and things like that, trauma they may have went through, things like that to support them in that. And that's where I want to end up at. I want to end up on that federal state policy side, changing policies around mental health access to care and what that looks like, and then I'll be satisfied.
What if you end up on that side and you realize in order to get a decision made, it's 15 years from one decision?
I'm gonna make sure it ain't gonna be 15 years.
The hardest thing when it comes to policy and politics is getting the room on your side, or at least getting them to understand why it's a need for this.
Right. Nah, true.
Yeah, that's where I think the real this is gonna be a handicap for a lot of people. My bad comes from.
Well,
nice sneakers, by the way, man.
Appreciate you.
Yeah.
Well, then, Juice, if I gotta run for office, I run for office.
I do what you gotta do, man. I ain't gonna stop you. I ain't gonna stop you.
I'll run for office too, man. But I got a small window I'm going to do this with, and then it's gonna shut down.
Okay. Now, speaking of stop, is there such thing as prevention when it comes to suicidal ideations? Like, what does prevention look like? Loaded, very loaded question.
You be hitting me some loaded questions all day.
But loaded questions, man.
Well, prevention is political. So,
okay, tell me more.
Prevention is political in the sense of that we always want to say we don't want to talk politics and involve politics in our conversation, but politics.
But everything is politics.
Everything is
politics. Everything.
The taxes you pay, how much you pay for this space right here, whatever, it's political.
It's all politics.
Yeah. So when we start talking about suicide prevention, you have to look at the economy. You have to look at wages, livable income, housing, affordability of quality of life.
Yeah. Keep talking.
Access to health care, access to mental health care, right? These things, I think, are all fuel into suicide prevention. And suicide prevention, tapping in with my public health folks, is a public health issue.
Yeah.
So it's a public health issue. It's not just symptomology.
Yeah. What's symptomology?
Just like this basic level of symptoms that would come about from a mental health condition or a physical health condition. Where we would just work specifically with that symptom. So if I'm depressed, I'm gonna work with depressive symptoms, and this intervention works for depressive symptoms, right? Yeah. If I'm suicidal and have thoughts about wanting to harm myself, how can I work with those symptoms of suicide? Things like that.
So, in your work, are you currently doing suicide prevention, or what is your work currently?
So right now, I would say no. Well, no, I take that back. I would say I do it in a fashion that is more community oriented.
I was going to disagree with you, but keep going.
More community oriented when I do certain facilitation efforts to help work with men, and making sure that they have a space to be heard and seen and felt. And then also, of course, I provide individual therapy as well. So that's another space. But those are more spaces that I do suicide prevention in the sense of clinical space, individual therapy, and then community-based kind of outreach support group status for men stuff.
Do you think that there can be a better execution of outreach and group work when it comes to mental health?
Yes.
How so? Give me an example of what you've seen and how it can be done better.
We just have to be more intentional about what the population that we're working with, right? And we have to fund it.
Yeah.
It can't just be a one-off. We've been talking about that. We have to understand how long things may have to take to get somebody to change. How long it may take for somebody to open up. How long it may take for somebody to be comfortable with coming to that space, right?
Yeah.
And so we have to also think outside of the box that doesn't involve traditional interventions or traditional evidence-based strategies that we have shown to be, okay, well, this has been working since such and such time, right? But this might not be the case for, and I'll use black men specifically, that might not work for black brothers.
Yeah.
You know what I'm saying? So
yeah, this is no longer the land before time.
So what can we do to help, brothers heal that meets the need, and then also, fund that.
Yeah.
Fund that, and then make sure that we are addressing it. It doesn't always have to be by the book. That's the thing.
I feel like we've brought this book subject up like 5 to 6 different times.
I feel like I built my whole entity, my brand, my business around not being by the book.
Yeah.
Because the practice is built upon, saying not non-traditional ways to engage black men into therapy who once they said did not go to therapy, but they do to go to therapy. They just need a safe space to be there.
Yeah.
Right? In a pandemic, virtually, all these things that was just, why would you start a business and a private practice doing that in this time? And it's not by the book.
Yeah, but when you look back at it, why not?
Yeah.
Yeah.
Exactly.
So it's Suicide Prevention Month coming up for September. And I think I may have a gripe with the community of suicide prevention.
Okay.
And it's going to be a very unpopular opinion.
Okay.
Right? Why do we advertise all the work techniques and interviews in September when there's 10 more months that this topic isn't getting attention? I say this because this actually is going to come up in a couple of interviews. Like, black people aren't February. We're February in June.
Right.
Right? Gay folks aren't just June.
Right.
So I have like a whole month of content that's going to be dedicated to folks who are gay, trans, other, that are going to be talking on mental health because we've helped them. And that's a demographic of my community that I would like for their voices to be heard correctly and succinctly, like concise with what they're saying and why they're saying it.
Right.
And when I look at a lot of suicide has been a topic heavy for a while now, not just coming out of the pandemic. It was the issue way before the pandemic. And now that a lot of children are getting involved, I feel like there's always the rush to hire a branding and marketing company, but there's never a rush to sit down with those in the medical field and ask, hey, what are you guys not doing? Does that make sense? There's always this, we need to market it and brand it, but there's never are we doing the thing we're doing right now? Like, we're not, I don't think there's enough questions on what it is that we're doing. Because and it comes back to the liability word. It comes when people ask, are we doing the right thing? I feel they're more asking, hey, we could not get sued for this, so we're okay, right? And it's like the right thing exists outside of what you've been taught. What you've been taught is the gear that you need to explore, but you're supposed to find new techniques or what works and share that with people and understand it may not work for them, but they should be willing to start thinking outside the box like you do to help someone.
Because people don't like change.
Yeah.
I use this example all the time. We here. We sitting here among this amazing little setup I love. All this technology,
put a lot of work,
lights and shoes and pictures, and it's very creative.
All the sneakers.
That's why I feel really energized in here, right? It's creative in here. I guess my creative juice is going. But own this space, well, you rent the space or whatever, but you're paying for this space, you're paying for utilities, you making sure you're getting your bills paid off, stuff like that. Paying my bills, this, that, and third. We have normalized how tough it is to just exist and live.
Yeah.
So when people see it, right, it's just like, oh, well, that's his life. That's, oh, well, you just gotta do what you gotta do. Like, I hate that sometimes. Like, you gotta do what you gotta do. This is hard. Everybody can't just be, susceptible to saying, I am doing a great job at paying my bills and just living, paying for high gas. Gas is $4.80 something a gallon. Groceries is overpriced. The internet is overpriced. The streaming is overpriced. Everything is super inflated. And then salaries don't match that.
Yeah.
Right?
Yeah.
So you talk about suicide prevention, and just to exist and to live is difficult. But somehow we have changed that narrative and saying, well, you just got to do what you got to do. That is suicide prevention. You saying that it's not going to be helpful to somebody who feels like they are drowning.
3 things you shouldn't say to someone struggling with suicide.